and welcome to the Cancer Research UK Cambridge Centre podcast, The Future of Radiotherapy series. This series is brought to you by the CRUK RadNet Cambridge programme in partnership with our lovely Patient and Public Involvement and Engagement Group. So hello, my name is Rachael Webster and I use she, her pronouns, and I'm your podcast host. So my role within the CRUK RadNet Cambridge is to promote and expand our patient and public involvement group. And I'm also a therapeutic radiographer in the radiotherapy department down in Addenbrooke. So to give you a little bit more about who we are as a programme, so RadNet Cambridge is one of 7 sites across the UK, which is a part of a radiation research network funded by Cancer Research UK. So Cancer Research UK have invested millions across 5 years to develop and grow radiotherapy research on a national and international scale. The money is being put towards infrastructure and technological advancements that will give us the resources to further our knowledge and understanding a bit more about radiotherapy. So if you want to find out some more, please visit our website on www.crukkcambridgecentre.org.uk/radnet. So you may have found this podcast through our interactive display in the radiotherapy department down in Addenbrooke Hospital. We hope that you find this information really adds to what you've seen. So for those that have not been to radiotherapy, we have a digital version of this display available on our website. The radiotherapy timeline display is one of our first patient and public involvement projects with the RadNet Cambridge programme, and this was supported by the Cambridge University Hospitals and by Addenbrooke's Charitable Trust. We wanted to create a display that's within the department that really celebrates you as the patients and the public and the involvement that we've had in the past and in the present. And this is to provide more information about what radiotherapy is, how it's developed, and how it's really developed with your involvement, most importantly. We worked in partnership with our patient involvement group to create this display and make the interactive elements, including this podcast. You may meet some of our lovely patient and public involvement members throughout the journey of this series. So our aim with this podcast is to bring together our researchers, clinicians, and allied health professionals with members of our patient involvement group to find out more about where radiotherapy practice might take us in the future. So we start with episode 1, which is with Raj Jana, our clinical oncologist here at Cambridge, talking about artificial intelligence in radiotherapy and how this can shape in the way which we plan radiotherapy treatment and see radiotherapy treatment in the future. Episode 2 is around something called service-guided radiotherapy, which is really a new piece of equipment that is being trialled at Addenbrooke Hospital Radiotherapy Department in the very near future. We speak to Christina Ferreira, our technical lead for radiotherapy here at Cambridge, and this is going to look at how this piece of equipment can really impact patients coming through in the real near future. In episode 3, we look at what proton beam therapy is and the benefits and challenges we may face with this technology. So we'll be joined by Indrani Bhattacharya, one of our clinical oncologists at Cambridge, and she's also the principal investigator for the Parable trial, which is a new trial for breast cancer comparing the proton beam therapy and our standard treatment, which is called photon treatment for a select group of breast cancer patients. So like I mentioned, this series is really shaped by you, the listeners. And if you have any questions that you would like us to answer in future episodes, or if you have any ideas for topics that you'd like to discuss on a future series, please let us know by visiting our podcast website at www.crukkcambridgecentre.org.uk/podcast. So thank you for listening, and we hope you enjoy this series.